afternoon, everyone, and welcome to A Gathering Place. And we're talking public health today. It's in particular the Affordable Care Act open enrollment that's coming up, and of course, some COVID updates. Usually, we do this on the third Wednesday, but the fourth Wednesday, excuse me, but we couldn't do it last week. It just so happens we had a last minute cancellation, and Miss Linda is joining us today from St. James Health and Wellness to talk about public health because we got some important news for everyone to know so you can get enrolled in the Affordable Care Act if you need health insurance. We're going to learn more with Miss Linda right after our opening. We'll see you in a moment.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question.
Well, we're here. We're going to talk Affordable Care Act, also known as ACA, also known as Obamacare, and upcoming dates that everyone needs to know. So let's bring on Linda Lynah. All right, Linda, how are you?
I am blessed. And yourself?
I'm doing great. Thank you, y'all. I have to learn too, because, we had technical difficulties. In other words, I had to turn on the mic to hear Linda. So it was all me. And y'all, we were serious too. We were like, what's going on? I can't hear. She can't hear me. I can't hear her. And I just had to hit one button. I honestly think I just probably just accidentally, just glanced my fingers or something across it, and I just wasn't looking. But I saw the light. So we're here, folks. So thanks for joining us today. We're going to just go through what we need to know about open enrollment. It's coming up. It's so important. And Lynn, there was a lot going on with the Affordable Care Act this year, also known as Obamacare. But I think we're now back into hopefully somewhat of a normal open enrollment schedule, and that's why we brought you on to tell us what we need to know so we can get prepared for the opening date, which is November 1st, 2021. What do we need to know, Linda, to get prepared for November 1st?
Okay, well, first of all, now that the August 15th enrollment deadline due to the coronavirus disease emergency has passed, you can still get or change your 2021 marketplace coverage only if you have a life event that qualifies you for a special enrollment. And basically, those events that qualify you are a change in your situation, like getting married, moving, having a baby, or losing health coverage, can make you eligible for a special enrollment. And basically, you would go back to the marketplace and provide the information that verifies your change. And then that way you would be able to get a approval to do the special enrollment period. And you may be asked to submit documents to confirm the life event that makes you eligible. So if you have any questions, feel free to contact one of us. And when I say us, I'm talking about community health workers as well as outreach workers, and we can further discuss that with you. And if you're not eligible to apply for the special enrollment period for the rest of 2021, then you can apply for 2022 health plans, which would become the open enrollment period is November 1st through December 15th, 2021. You would also be able to start getting your coverage if you enroll by December 15th, 2021, and that would start January 1st, 2022. You can also enroll up until January 15th to do the 2022 year, but your coverage won't start until a later time. Now, as far as what information you would need to provide in order to enroll, you would have to provide the names and ages of every individual that lives in the household with you. And if they are someone that you carry on your taxes, whether they are an adult or not, then you would still be able to have them covered under your plan. The other is that if you don't claim a tax dependent, then don't include them on your plan. As far as if your children are at a certain age, such as 18 and older, then you need to make sure that they are covered, because you do have some children that are older than 18 and that are independent and have their own income. And if they do, then you would not want to include them on your plan. As far as the various plans that are going to be on the health insurance marketplace, they haven't indicated what those are, as well as what the income limit is going to be. So hopefully within the next month, that information should be available so that you can get an idea as to whether or not you are or are not eligible to go into the health insurance marketplace. And if so, then you can somewhat get an idea as to what you would be paying for your premiums, what plans are available, and also to find out the various providers that you can go to with your plan. And once again, if you do have any questions, feel free to give me a call. And my number is 843-826-3773. And then also, if you're interested in applying for Medicare, Medicaid, food stamps, then we are also available to assist you with that, and you do not have to be our patient.
Very good. So I'm glad. Thank you for preparing folks. You know, Linda brought this up to me early. We need to get prepared. We need to get folks prepared for open enrollment. And at the bottom of the screen, everyone, it's telling you Monday, November 1st is the opening date. It closes Saturday, January 15th, 2022. But if you enroll by December 15th, 2021, that means your insurance starts January 1st, 2022. So there's no gap. If you have insurance now, if you're under the program, there won't be a gap. So we have that information down there, folks. You can go to healthcare.gov to get more information. But as Linda has said, there are just some things that are not there right now. They haven't updated them yet, but you can call her and she'll be happy to share that information with you, additional information with you. There was one more thing, Linda. I forgot what it was. I was going to say about that, but nevertheless, that's what's happening now with ACA open enrollment. And Linda, thank you for coming on and letting us know that. And keep up to date with healthcare.gov, folks, to learn what kind of paperwork you need to bring, because you're going to need to prove your income. Mm-hmm. All right. So very good. So Linda, you wanted to talk to us also about COVID testing. Yes. And also the vaccine. What's going on at St. James Health and Wellness?
Well, as you're aware, we're still doing testing and we're also doing vaccines, because it has been indicated that the numbers are somewhat rising. Mm-hmm. And as a result of that, then the testing as well as the vaccines are back in full force. So if an individual needs to be tested, we do testings at our different locations on certain days. At the McClellanville site, we do testing on Fridays, and it is recommended that you call and schedule an appointment. And the number that you would call here is 843 887 3274, or you can call one of the young ladies listed on this paper, which is Brenda Perkins, and her number is 843 520 7789. Or you can call her cell, which is 843-344-3607. Then also we have Miss Jerry Davis, and her office number is 843-904-9305. Her cell number is 843-359-4238. And then we have also Miss Anna Watts. Her number is 843-264-2680. And we have Miss Alicia Cooper, and her office number is 843-990-7970. And the locations and days that the testing and is being given is at the North Santee, which is our Sanford site, and that's located at 2482 Powell Road in Georgetown. That's on Wednesdays. And the number to the center itself, if you can't reach one of these young ladies, is 843-527-7533. And on Wednesdays, we are open from 9:30 to 6:30. And then also at the Andrews site, which is located at 675 North Morgan Avenue in Andrews, South Carolina, that telephone number there is 843-264-2680. And their day of testing is on Tuesday. And when you at the Choppy site, that's a Monday. That address is 8189 Choppy Road, Georgetown, South Carolina. The telephone number to the actual office is 843-545-8723. And at our Fraser Street, which is also in Georgetown, they are providing testing on Wednesdays. Their address is 422 Fraser Street, Georgetown, South Carolina. The actual number to the office itself is 843-436-1333. And we also have an annex in Andrews, and that's at 411 East Main Street. And that's Andrews, South Carolina. The number there is 843-264-1223. And they are doing the testing 3 days a week, Mondays, Wednesdays, and Fridays. So these are the different locations. And if you're interested in getting the vaccine, then you can talk with them and they can let you know what day it is available at their particular site. And once again, you don't have to be our patient in order for us to do the testing and as well as to do the vaccines. Now, once they do the testing, they will let you know when the results will be back in. They will reach out to you and let you know what your results are and what is the next step you need to take. When you come in to do a vaccination, how that works is that you come in, you fill out whatever necessary paperwork. You have to get the vaccine. Then once you do, you have to wait for approximately 15 minutes to make sure you don't have any kind of negative reaction. And then the provider will talk with you briefly. And then after that, you will leave. If you're coming in for the first vaccination, then your second is going to be at a month later. And then you go through that same process again. Now, Marilyn, I see you have put up the paperwork. And one thing I need to point out is under Miss Jerry Davis, that sale number is incorrect.
Okay.
And her cell number, again, is 843-359-4238.
All right. Very
Okay.
good. Thanks for letting us know that. But
You
you
are.
can go to their website and find out information about COVID and the appointments that you must make for that website. And of course, they have a Facebook page also that
Right.
they keep up to date with the latest information. All
Right.
right. So if you want to help end the pandemic, as they say, call St. James Health and Wellness, and we will keep those things up to date.
Okay.
All right, and get everyone an appointment. I wanted to put up. Hold on, I have it.
Uh-huh.
Let me close this share page here.
Okay.
The numbers in Georgetown,
Mm-hmm.
and you can clearly see why it's important to get vaccinated, because that's who's in the hospital.
Mm-hmm.
27. This is Georgetown.
Mm-hmm.
Hospitalized. 9 are in ICU and 6 are on the ventilator.
Mm-hmm.
Fully vaccinated folks. There are breakthrough cases, folks, but you can clearly see the difference. 2
Mm-hmm.
hospitalized, 1 in ICU, 1 on ventilator. Your chances of recovering when you are vaccinated are much, much better. And I was just reading, Linda,
Mm-hmm.
424 of our fellow South Carolinians died last week.
Mm-hmm. Exactly.
And nationally and in hotspots in South Carolina, so hotspots because we've had issues with mask wearing, etc. The
Exactly.
numbers seem to be rising.
Yes.
Yes,
Yes.
steadily rising. And folks, why this is important to get vaccinated. Now we're entering flu season.
Mm-hmm.
Now we're entering the winter. And what are
Mm-hmm.
we going to do when we're in the winter? We're
Exactly.
inside more often. We're going to be coughing around each other.
Exactly.
We're going to be touching spaces more that other people have touched,
Exactly.
which will increase your chances of getting COVID. But to prevent that, there's something that you could do, and that's
Mm-hmm.
get vaccinated and wash your hands
Mm-hmm.
and wear a mask.
Exactly. And the other thing, Marilyn, that we realize and are more than happy to set it up and participate is that sometimes people don't feel comfortable because they don't understand the full significance. So if any individual, be it an agency, a business, and even religious um, facility would like for us to come out and do a forum where we can sit and answer questions, hear people express their concerns, that would make them more comfortable to want to be able to get the vaccines. Yeah, there are some things that are out as far as some people have actually gotten the vaccines and still ended up getting the virus. However, questions like that would be able to be answered at a forum and would hopefully help you to make an informed decision.
Yeah,
Go ahead.
I think people, one of the concerns of here, if I get vaccinated, why do I need to still wear a mask? What we're trying to do through vaccinations, wearing the mask, is achieve herd immunity.
Mm-hmm.
And you achieve that much faster by getting vaccinated and people wearing the mask. And I think, what's the percentage? Because I know that kind of changed as we've gained more information. We're trying to reach either around 85 to 88%.
Right.
Vaccinations, herd immunity, that will lead to herd immunity.
Right.
And that's why you have breakthrough situations, because we haven't achieved that yet.
Right.
And that's why we need to continue washing our hands, wearing masks. More and more of us need to do it so we
Mm-hmm.
can get the herd immunity, because that's basically where we are with polio, measles, smallpox.
Mm-hmm.
We've actually basically eradicated smallpox, measles from the United States, because
Mm-hmm.
herd immunity protects those who can't get vaccinated for
Right.
health reasons or religious reasons. If we reach that percentage, then we're basically, because of herd immunity, stopping the virus where it's at and
Mm-hmm.
shrinking it to it basically
No longer exists.
Yeah, it's no longer where you could just go out and breathe it and you
Right.
catch it,
Right.
that's it. That's it.
Mhm.
It's not that complicated. Other than we've made it politicized to the point where we're hurting ourselves and people are dying unnecessary. So,
Mhm.
let's just try to be part of the solution.
Mhm. And the other thing is so that people will know that we are doing the Moderna. And as you all well know, Moderna right now is only available for adults. However, they are working on trying to get it where it can be provided to adults as well as children. So with Pfizer, that is a product that can be given to adult as well as children. And then also just recently, they have a booster. And again, they're working on a booster for Moderna. So, with that being said, you could still come to us and get Moderna if you feel comfortable with Moderna. And then once the booster becomes available, then you would be able to come back to us and get that booster because whatever vaccine you start with, that's what you're going to have to end with. If you came and got a Pfizer, you have to go back and get a second Pfizer, and the same thing with your booster. If you came and got a Moderna, then you can't go over to Pfizer to get the booster. You have to get the booster from Moderna. So we want to make sure that, people do understand that because we wouldn't want someone to go out thinking that, okay, well, I had Moderna last time, I can go get Pfizer this time. No, it doesn't work that way. And the other thing is that make sure, as Marilyn said, that you wear your mask. Like I said, there have been some people that have had both vaccine and still one way or another has ended up with getting the virus. So take every necessary precaution to keep yourself safe and well. And especially if you're going into an indoor environment, and especially as Marilyn indicated, when it starts to get cold, that's when they're predicting that this variant is going to go back up again. And as you all have seen in the past, not only does it affect us health wise, it also affects us emotionally and financially. I was listening to the news last night, and they're saying that there's going to be a lot of stuff that's going to go up because of shortage. And that shortage is real. I went to a Walmart and they couldn't open because they didn't have staff in their auto department. And I've never had that experience before until the other day. So, those are things that we need to remember and take whatever necessary precaution that is needed in order to be able to survive. Now, with the COVID-19, they're still doing the funeral assistance. And so if a person has helped someone, family member or friend with paying for their funeral expense up to 9,000, the maximum is 35,000, you're still able to get reimbursed. And this is any funeral expenses that incurred after January 20th. And you would also have to have a copy of the death certificate that shows that the person actually died from COVID. The other thing is that we have available mental health providers that can talk with you and allow you to express yourself so you can feel better, because with all the different things going on, it's a lot of stress, and we need to be able to relieve or release that stress in one way or another. We are available to assist small businesses. So if anyone has a small business and needs assistance, we would be more than happy to talk with you and see what type of assistance that we can give as far as maybe coming out and doing a vaccine event. And if we do an event, We have to make sure that we have at least 10 or more persons that have signed up and will be at the event to have the vaccines given to them. Because otherwise we would waste it, because once those vaccines are open, they have to be used. Otherwise, they have to be disposed of. And we don't want to have to throw away good medicine. So again, if that's something that you're interested in doing, it even at a church or whatever within the Georgetown, Charleston, Berkeley County area, then feel free to give me a call and we can talk and see if it is possible for us to be able to set that up. The other thing is that tell your friends and family about the various programs that we have on A Gathering Place that have talked about mental health, have talked about the effects of the COVID-19. We even had two ladies who actually had the COVID-19 experience, and they talked about that, as well as to also let people know that they did get the vaccines. And we had two young men, and we're hoping to bring them back on possibly next month. They're between the ages of 12 and 13, who talked about their experience in actually getting the vaccination. So it's a lot of good information on there that maybe will answer some of the questions that you may have. The other thing is, make sure that if you meet the criteria for the advance payment of the 2021 child tax credit, that you do take advantage of it. And the basic information about that is up to $3,000 per qualifying child between the ages of 6 and 17 at the end of 2021. And if it's up to 3,600 if the children are under age 6. So once again, to get the information, you can visit irs.gov/child tax credit 2021. And just so you all are aware, and this is something somewhat different, and it's primarily focused for our males, and it's a prostate cancer education training. And basically, the South Carolina Prostate Cancer Screening Program for African American men, and it's called SCA Men Program, is an innovative approach from MUSC Holland Cancer Center to address prostate cancer disparities. And it is a virtual 1-hour dynamic training session, and it's free, and it will increase your knowledge about prostate cancer. And basically how it works is you get a 1-hour training session, 3-month follow-up survey, and you're compensated at the end of the program. And what you would learn is prostate cancer risk factors, prostate cancer screening guidelines, prostate cancer treatments, and also steps to reduce cancer risk by improving your overall health. And why does that matter? Because prostate cancer is the most commonly diagnosed cancer among African American men. Prostate cancer is the second leading cause of death among African American men in South Carolina. And the incident rate of prostate cancer in African American men in South Carolina is 2 times higher than the rate in white men. So if this is something that your church, agency, organization is interested in participating in, then please feel free to give me a call, and I can give you the information where you can sign up and be a part of that particular program. So those are some of the things that are available. We will be having an event in November, in which we will talk more about possibly next month. And if you have an event and you would like for us to be there doing open enrollment season or prior to that, then please give me a call, and then we can discuss it further as to, what you would like for us to do, and we could look to see if it is a possibility. And my number is 843-826-3773. And as you can see on the screen, my name is Linda Lynah, and I'm the Community Relations and Outreach Supervisor for St. James Health and Wellness. And at this time, I want to thank Marilyn for allowing us to come on each month to give you this valuable information. And I also want to say to each and every one of you, stay safe, be careful, follow the rules and regulations, and feel free to give us a call if we can help you. And may God continue to bless each and every one of you.
Linda, thank you very much. Thank you for the information. There's Linda's phone number at the bottom of the screen, folks. You can call her, as she said, with additional questions, and she's here to help you in her position at St. James Health and Wellness. So we're always delighted to have Linda with us because she gives us great information. Today, we talked about the ACA open enrollment, and that's coming soon on November 1st. So get prepared. Go to healthcare.gov, and they'll give you the information that you need to provide to get enrolled. And of course, St. James Health and Wellness is always doing testing and vaccines to help us help ourselves to stay healthy and stay alive on this earth, because we all got a lot to do.
Amen.
We all got a lot to do, and God has given us the opportunity to do that by giving us vaccines, the ability to wear a mask and wash our hands. So, Linda, thank you for reminding us of that. And
You're
always
welcome.
is good to have you on. Thank you, everybody, for joining us today. And Linda, we'll be back on our regular schedule.
Okay, and thank you for having me. I really appreciate it.
Yeah, we'll be back on our regular schedule. And thanks, Linda. Good to see you as always. This is how
Same
Linda
here.
and I see us most of the time now. Because y'all, we want COVID to end so people can come back
Yes.
together.
Yes.
Yeah, in a healthy way. And thank you, Linda. I really appreciate
You're
it.
welcome. You're welcome.
All
Thank
right.
you.
We'll see you later.
Okay.
Have a good day. We'll talk
Bye,
later.
everybody.
Bye-bye. And I want to remind everyone that we have coming up, and COVID is, we're considering how we're going to work this because COVID with the rising numbers. But on Saturday, October 16th, is the Gullah Geechee Environmental and Energy Conference. You can go to our Facebook page and register today. Right now, it is hybrid, but we are keeping an eye on those COVID numbers. They are rising, and we don't want to have something in person that's going to create a super spreader event. And that's just the bottom line, folks. So we will make a decision after Friday, October 8th, whether we're going to have this as a hybrid in person and virtual, or just go all virtual. But we are excited to present the third annual Gullah Geechee Environmental and Energy Conference. That's through the grant presented to us by the Climate Reality Project. We're making this happen this year. In person, we'll be at Royal Missionary Baptist Church, but go ahead and enroll, get registered now, because once you're registered, we will let you know whether it'll be all virtual or not. But we're excited about this, folks. This is us in our community solving our environmental and energy problems. So we're going to hear from communities throughout the Gullah Geechee corridor, and we're going to also hear from our environmental and energy resources partners. And there's just a lot of good information out there, folks. So you go to our website now and get registered, and go to GullahGeecheeFoundation.org and get registered. And if you're on our email list, you should have received this, or you will be receiving it in your email so you can get registered. We're so excited. Thank you, as always, everyone, for joining us. And we look forward to you this Sunday at 4 o'clock as a gathering place. Woohoo! We do it twice a week, every Wednesday and Sunday at 4 o'clock p.m. We'll see everyone. Enjoy the rest of your day. Good night.